I have two of our affiliate physicians here to join us and talk about advanced procedures today. It's a really exciting topic that is very prominent in interventional pain today. With me, I have Dr. Jesse Hatches. He is with Anesthesia Pain Care Consultants in Tamarack, Florida. And I have Dr. John Hong, who's with Gateway Spine and Pain Physicians in Chicago. So to kick it off, I'm going to have Dr. Hong. Can you tell us a little bit of your background, a little bit about yourself?
Yeah, sure. So thanks for inviting me, Mike. It's great to be able to be part of this podcast. So I'm an interventional pain specialist. I practice in the suburbs of Chicago. I'm board certified in anesthesia and pain medicine. And I've been in practice now for about a little over 16 years, I believe. Time flies. And so I've been able to kind of witness this evolution of interventional pain real time, so to speak. So it's been an exciting field and excited to talk about it today.
Awesome. Dr. Hatches.
Well, thank you also for having me here. It's been a pleasure to know and work with both of you guys here. So I basically did all my training in South Florida from internship, residency, and fellowship in the South Miami and kind of Fort Lauderdale region. And I wound up moving out to Arizona for about 5 years and working with a couple of practices out there, and was really able to develop not only a good kind of patient mix and really kind of sow my oats, but get a really firm grasp on advanced procedures out there. I was exposed to a lot, and I brought that back to South Florida, where I've been practicing as part of the DxTx network and Anesthesia Pain Care Consultants for a little bit over a year now. And I am double board certified as well, although I did my residency in physical medicine rehabilitation and then followed that up with a 1-year pain management fellowship.
Awesome. Yeah, we are very lucky at DxTx Pain and Spine. We have such a large footprint, and we have tremendous physicians throughout our network. So really glad to have you guys on board. First off, there's been a lot of advancements in interventional pain in the last 5 years. Can you talk about what specific treatments have you most excited? I'll start with Dr. Hong.
Yeah, just to echo that sentiment, it's been really fascinating to watch the evolution since I started practicing. When I started practicing initially, it was primarily epidural, cortisone shots, facet injections, radiofrequency ablations. We did spinal cord stimulators. The technology of the stimulators have advanced considerably over the past 10, 15 years. So that's been a game changer. And then we relied more so than we do now on just medication management. That's still a part of what we do, but it's become less and less integral, especially given the whole opioid crisis. And then over the past 10 plus years, we've seen just this explosion of advanced treatment options that have really increased our toolbox, so to speak, of different options that we can offer patients. I often tell my patients, and when I talk to other people, it's kind of like the cardiology space where, 10, 15, 20 years ago, so many people were getting open heart surgeries. But now with the advent of interventional cardiologists, we're able to treat so much more minimally invasively and avoid larger, open, more riskier situations. So one treatment that I have a particular interest in that really speaks on this behalf is a treatment called lateral transverse arthrodesis, which is commonly referred to as the Minuteman procedure. So this is a device that is implanted in the posterior aspect of the spine between the spinous processes. And so it's implanted just using a small incision, minimally invasive. The procedure itself, we usually treat one level at a time, and it typically takes about 30 minutes. It's an outpatient type of situation. Patients go home right away. And the amazing thing is they can feel so much better so quickly. The ideal candidate for this type of treatment is a patient with degenerative spine, degenerative discs, arthritis of the spine, signs of instability. And in the past, a lot of times these patients would, they've exhausted all of their options. They've done physical therapy, epidurals, facet injections, and, they'll consider surgery, but usually it's a pretty big open surgery, such as a fusion. And, unfortunately, a lot of these patients are oftentimes just not a great candidate because of age or other comorbidities. So there really hasn't been a great option for these patients. And then they end up in a wheelchair, just less active, less healthy, and it's rather unfortunate. And so this device basically stabilizes the spine. It opens up the spaces around the nerves. It reduces motion in the facet joints, and it can take a patient from being, very immobile, limited walking, hunched over at the grocery store, shuffling along, to somebody who can now stand and walk and mobilize and just live a better quality of life and a healthier life. So I've been doing this treatment now for almost the past year, and I've had some amazing outcomes, and patients are just ecstatic when it works, which is the majority of the time. So this is an example of a newer treatment and advanced treatment that's really getting me very excited.
That's great. Dr. Hatch, same question for you. What are you seeing in advanced procedures that have you excited and getting some great results with?
Well, I very much agree with Dr. Hung. I think that's an amazingly good procedure. I actually started doing those in 2020, I believe, and they had the two different systems. So now they're on the G5 iteration of their equipment, and it's looking pretty good. Now, the lateral approach itself, what's nice is that, that's not the only device, on the market either that does the same things for the same conditions that you mentioned, Dr. Hung. So what's good about it is that there are other ones that are not lateral, but they're either directly posterior or they're posterior lateral systems that accomplish the same things in slightly different ways. And each one kind of has their benefits and their negatives, which we don't have to go too far into today. Otherwise, we'd be here for a long time. But I think that's a fantastic procedure because it treats multiple different things, as you mentioned, right? So it deals with stenosis. It deals with just degenerative disc. It can deal with facet arthritis. It can, it's even on, it's on the books with the FDA for approval with certain fractures of the spine too, which I would never personally treat it for that, but it's on there. So that's a highly exciting procedure for me. And there are many others. And I haven't really been around for as many years on my own, as you have, Dr. Hung. But even in my slightly shorter amount of time practicing, I've noticed a huge shift in what I was doing post-fellowship and where I am today. So like you said, it was mainly, okay, let's do epidurals, let's do facet blocks, radio frequency ablations. And if that doesn't work, then we're looking at either surgery or maybe a spinal cord stimulator to control that. My spinal cord stimulator numbers used to be crazy. I was doing, over 100 cases a year for spinal cord stimulation because a lot of people didn't want to do surgery. Or they maybe had surgery already and nothing further within the surgical realm was really a good option for them. So it was stimulation. I have noticed a dramatic decrease in the amount of spinal cord stimulation as a whole percentage in my practice compared to what it used to be even a few years ago because of all this new stuff, right? Because of all these great procedures like you mentioned, like the Minuteman SI joint fusion, sacroiliac joint fusion has been huge within our practice and the results have been phenomenal. The mild procedure, so the minimally invasive lumbar decompression, which pretty much is done through something about half the thickness of my pen here, has been wonderful for patients that have had spinal stenosis with neurogenic claudication, that kind of shopping cart syndrome that you alluded to before with stenosis, where if you're going to Publix or whatever your local grocery store is, and you notice people that are just kind of hunched over that grocery cart and they can't get themselves to a neutral position, they probably have spinal stenosis, and it might be due to this thickened ligament that is just compressing or kinking the straw of the spine, so to speak. So that's been wonderful. And we've used that a ton within our practice. And really, those have been 2 or 3 procedures that have been just completely mainstay. On the field of neuromodulation, that in itself is a whole podcast in terms of the benefits and the expansion in FDA approvals for what we could even do at this point. So it used to just be for failed back surgery syndrome or complex regional pain syndrome. Now we can do it for diabetic peripheral neuropathy. We could do it for certain vascular diseases. We could do it for non-surgical back pain. It's been a huge boom in terms of who our patients could be given FDA approvals for that, plus all the technology, which again, that's for another time. But even peripheral nerve stimulation has come quite a way for peripheral nerve issues that spinal cord stimulation might not be able to handle in a very detailed or fine-tuned way. So for instance, you could do peripheral nerve stimulation for the knee and it just goes to the knee, as opposed to if you did spinal cord stimulation for the knee, you might have to capture the whole leg or the whole thigh in order to get benefit from that, which may be overkill in certain situations. So I'm sure I'm forgetting 1 or 2 procedures there, and I think we need to leave some content maybe for another time. But I think that's a good start in terms of at least giving an overview for some of the things that really have been just practice changers, at least for myself and I think for Dr. Hung over the last probably half a decade.
Yeah, that's certainly, very exciting, and hopefully a lot of clinicians will see this, but I'm sure there's going to be some patients that or future patients that are going to also view this. So Dr. Hong, can you walk us through a little bit of what is a patient, what's the progression that a patient would go through leading up to the time that maybe they start seeking treatment for their pain to where you would say, okay, now it's time for an advanced procedure?
Yeah, I mean, so there are treatment clinical algorithms that we follow, and generally speaking, we try to start conservatively and then advance things appropriately. So when a patient first comes in, of course, after doing a full assessment, evaluation, physical exam, reviewing medical records, and kind of discussing with the patient what their goals and needs are, we come up with a plan. And conservatively, of course, physical therapy, perhaps some anti-inflammatory medications. But generally speaking, by the time they come to us as interventional pain specialists, they've usually exhausted those things. And then upon reviewing their imaging, we're going to determine what are the potential pain generators, and then come up with some type of plan to identify that. And that usually involves doing some type of nerve block or cortisone steroid injection. And then we take it from there. However, if they're continuing to experience a significant enough level of pain, and they're just not getting better, but we have some ideas as to where their pain is coming from, then it's typically at that point that I start thinking about things like the Minuteman procedure, some other interspinous spacer, or a mild procedure to debulk the ligamentum flavum, or a targeted neuromodulation technique like Dr. Hatch just was suggesting. And there's just such a wide spread of treatment options these days. And we don't want to be kind of a shotgun approach too much. And we want to really try to approach this with the mindset of really honing in on what the pain generator is, what the underlying defect or malfunction is, and how can we specifically address that. And I think this is what's exciting about the field, is we're getting more and more tools to really target our therapies appropriately, as opposed to just one hammer type of approach.
It's interesting. I've been in the pain space now for about 6 years, and coming in, seeing in the last 6 years how things have progressed. And I think most patients, when they hear interventional pain or pain physicians or pain clinics, they have sort of a stereotype of what they're going to get. So us at DxTx, by having such a large footprint and being able to touch so many markets, letting people know just how many options are out there. And there's a lot of hope out there outside of just what they may think through just medication or some of the, PT or chiro that they might have tried in the past. So, hearing these advancements is just super exciting because we know that, over a third of the population over age 50 suffer from chronic pain. So having these options are just wonderful. Kind of moving on a little bit. So, Dr. Hatches, is there anything? What do you think the future holds as far as advancements in pain? Is there anything that's in the pipeline or that you're hearing about that has you excited, or do you think could be a potential game changer?
Absolutely. There's so much within this. I first of all want to say that the way that I approach, getting a patient to an advanced procedure really, is 99% what Dr. Hong mentioned. So, I think it's really it's the right way and the only way to approach that. Now, one time where I will maybe start with an advanced procedure prior to a non-advanced procedure is in a case where if I review the imaging and I see the ligamentum flavum causing stenosis is really, really, really thick, I've done enough epidurals to know that the epidurals are just going to last a very short amount of time. So I might start with something like that to kind of clear up the roadway for maybe epidurals or something else to work, in the future. That would be the only thing I add to that. For the future, there's so much. I mean, just the field of regenerative medicine now is booming. Something we didn't discuss yet, but our clinic at least, is heavy in terms of utilizing platelet-rich plasma or PRP. Technologies on that continue to advance. For those listening who don't know what PRP is, it's basically derived from your own blood, where we get a vial of blood, we put it in a centrifuge, just a little spinning machine, and it sections the blood off into different layers. And one of the layers contains a very concentrated product of growth factors, which allow for damaged tissues to be repaired. So we use that for pretty much almost everything, whether we're dealing with facet joints in the spine, whether we're dealing with knees or shoulders or SI joints. I mean, it could be really used for almost anything. And there's good data in most regions at this point too, that have been accumulated for the past 2 or 3 decades on that. Another thing is stem cells, which have been around for a while, but most people don't use them at least as first line for a majority of pain conditions because it's considerably more expensive than the PRP route. And then something else which seems to be exciting and promising is even exosome therapy. It's in beginning stages. There are INDs, so investigational new drug, trials that are out now that are approved by the FDA to start on. So I think within a few years, that's going to be something that adds a tremendous value to the space of regenerative medicine there too. That to me is probably most exciting. However, within the field of neuromodulation, there's just constant improvement in terms of different waveforms to achieve decrease of neuropathic based pain. There's different, chargeabilities of the batteries that are used for these devices to where now many of these therapies, you only have to charge maybe once every 6 months or once every few weeks, which is tremendously different than, other ones in the past, which maybe you have to charge every day, or the battery might die out after 2 years and you have to go back into surgery and have a replacement of that battery. But the replacement's not as easy as changing a battery on your remote control of your television. It's more, you have to actually cut yourself open again and have that procedure. And anytime that you could avoid a surgery or avoid having to reopen an incision that was made earlier is clearly beneficial. So we can go further and further into this with almost every aspect of these advanced procedures. But I think as a whole, in terms of the technologies that we really see the most progress in, certainly I would say it's regenerative medicine and neuromodulation. And for sure, neuromodulation is now well into the AI space. So there's 1 or 2 companies that are even using AI for reprogrammings of these spinal cord stimulators, which I find just fascinating and kind of cool, but scary at the same time to a degree.
Dr. Hong, is there anything that Dr. Hatches hasn't mentioned that also has your interest.
No, I agree with everything he's saying, and I will echo that it is a little scary when these devices are going to possibly be smarter than us and implants it into us. But yeah, I think the regenerative space, just to echo that, it is very exciting. I mean, throughout, historically, we've essentially tried to reduce inflammation or block pain pathways. But really, the next step, the next horizon here is to actually try to restore health back to tissue and regenerate tissue and be more preventative in a sense, to prevent these chronic pain issues from even developing. So that's a really exciting thing. And I think the other trend that I'm excited about, which I think will continue to evolve, is just the tools that we have to provide mechanical stabilization, which include things like the lateral transverse arthrodesis and SI joint fusions, even like minimally invasive surgical techniques that are really kind of blurring the lines between what an interventional pain doctor does and a spine surgeon. And so that's again another talk, and can create some debate, controversy between the different specialties, because there's always a turf war involved. And it's not just our specialty, it's a lot of different specialties. But I think that area is going to continue to evolve, and I think in the future, we're going to be able to offer more and more stabilization to the spine and other structures in the body through minimally invasive techniques. And I would imagine that scenario that's going to continue to progress and develop.
Absolutely.
Awesome. Well, I know both of you guys are seeing patients today, and taking a little bit of time out of your schedule to talk to us. It's very interesting, very helpful. I want to thank you both for coming on and sharing your insights. Really look forward to, Dr. Hong touched on how the different specialties start to integrate. And in our next installment, we're actually going to have an orthopedic surgeon on and talk about how interventional pain and the relationship between interventional pain and orthopedic practices. So that should be a fun discussion. Look forward to everybody joining us for that. In addition, if you get a chance, take a look at DxTxPAS.com. That's DxTx Pain and Spine, and check out our website. You can check out in our affiliate network. We have some additional videos, and just want to thank both of you for talking with me today and sharing your insights.
Absolutely. It's a pleasure.
Yeah, thanks so much.